One of the more common complaints that patients come in to see me for is numbness and tingling in their fingers, and it often turns out that they have carpal tunnel syndrome. We are seeing an increase in the incidence of carpal tunnel syndrome because many people don't realize that carpal tunnel syndrome is associated with diabetes. So diabetes is a risk factor for developing carpal tunnel syndrome, and patients develop numbness in their fingers that often awakens them from sleep at night. They wake up feeling like they have to shake their fingers out. They can't sleep through the night. Many times, all they need to do is wear a splint on their wrist at night, and they'll be able to sleep through the night. But when they start having numbness, where they're awakening from sleep at night despite splinting, then it's time to do further investigation. And usually we'll send patients for an electrical study, an EMG nerve conduction study, which will tell us if there's a pinched nerve, where that pinched nerve is, and how bad it is. And we can tailor treatment appropriately for them. So when carpal tunnel symptoms become recalcitrant to our normal treatments, for instance, if you're wearing splints on your wrist at night, but you're still having pain that awakens you from sleep at night, if you're having daytime numbness symptoms, for instance, numbness with driving, if you're having difficulty with fine manipulation, difficulty buttoning buttons, difficulty putting on earrings, if you're dropping objects, those are signs that you might have carpal tunnel syndrome that has advanced to the point of needing surgery. In my practice, the vast number of carpal tunnel cases are done endoscopically or minimally invasively through a small incision at the wrist. It's an outpatient procedure that we do either under straight local anesthesia or local anesthesia with a little bit of intravenous sedation for comfort. Typically, your sutures are removed at a week's time, and you're using a splint on your hand for a few weeks after that, but essentially using your hand normally for driving, eating, and writing and typing immediately after surgery. It's well tolerated, and it works very well for relieving the numbness and tingling, especially that numbness that's awakening you from sleep at night.